I spoke with Dr. Anthony Fauci. He's director of the National Institute of Allergy and Infectious Diseases. And I started by asking him whether Zika is headed outside Florida's borders.
Yeah, that's entirely conceivable. I mean, I hope it doesn't happen, but when you have travel-related cases like we have in Florida, they have about close to 500 travel-related cases, which means that people got infected elsewhere and came to Florida. They have the right weather and environmental conditions, which make it difficult to control mosquitoes. So I would not be surprised if we see more both individual cases and perhaps even small clusters, as we are already seeing in Florida and in other Gulf Coast states, particularly places like Texas and perhaps Louisiana, that you might also see that. I hope we don't, but I think we should be expected and not surprised if we do see individual cases along other Gulf Coast states.
And with Louisiana's flooding, does that increase the likelihood that that is going to happen?
Well, during the process of flooding, it does more to get rid of mosquitoes temporarily, but then after the flooding, there's a real problem with standing water that make it a very good environment for mosquitoes to flourish. So it's sort of a two-edged sword. On the one hand, during the destructive phase of the flood, you just wipe everything out, but then when the flood resides, you have a lot of standing water, and that's the thing that people are concerned about, less the flooding than the post-flooding situation.
Now, Dr. Fauci, back in May 25th, actually, you said this.
New risks, even though they're much less risky than a risk of getting on the Beltway every morning, which is probably more risky than anything that your patients face, there's the extra twist with this. When the risk is to your developing baby, that trumps everything.
But now there appear to be studies that suggest that the adult brain is also affected by Zika. Do you have those? I mean, do you concur with those?
Well, I think we should be careful about making the connection between that study in a mouse model and anything that we're seeing with the adults, in which we have thousands and thousands of cases of human adults who are infected with no apparent deleterious consequences whatsoever. You want to pay attention to the studies in the mouse, but we have to be careful. It may not be applicable to anything in the human, although you don't want to just dismiss it. If you look at the study in the mouse, they found out that infecting the mouse, it attacked certain stem cells in the brain of the mouse. But what they didn't do is they didn't show whether or not that particular type of infection had any effect at all on the adult behavior of the adult mice. So we've got to be careful. You know, when people do studies in animals, you pay attention to them, but you don't make any policy or any other conclusions related to that until you do good epidemiological observation in the human system. And in that regard, we have not seen any indication that there's any damaging effect to an adult. They tend to get infected, they clear the virus, and they're fine. The only issue that you mentioned, that's the important one, is to focus on protecting pregnant women, because the fetus of a pregnant woman is the vulnerable party here.
Last thing, Dr. Fauci, can this be stopped? Can Zika be stopped in its tracks?
I think it can. I think it, if done properly with regard to mosquito control in our country, in continental United States, we have the capability in most of the country of being able to, prevent any kind of a outbreak other than an individual case related to a travel-related case. In the Gulf Coast states, right now, during the summer, in which it's a semi-tropical situation and difficult to control mosquitoes, we may have to realize that this may be around for a couple of months or longer until we can get better control over the mosquitoes. So when you say stop it in its tracks, I think if you mean preventing it from becoming a major outbreak, I think that's absolutely the case. I don't think we're going to have a major disseminated, diffuse outbreak throughout the entire country, but I do think we have to pay attention to those states, particularly the Gulf Coast states, in which it might be difficult to control mosquitoes. Puerto Rico is a different situation. Puerto Rico has a very serious problem now. The conditions there and the rate of infection that we're seeing, they're having a major outbreak. So you have to distinguish between the continental United States and Puerto Rico. Puerto Rico has a major problem with Zika.
But there won't be any vaccine on the horizon, is, I guess, stop it in its tracks question.
Well, vaccine is more of a longer-term solution. We started the early phase 1 trials to determine safety of one of several vaccine candidates that are lined up to be tested. We're going to go into a bigger trial in about 20 sites involving countries that have outbreaks. We're going to start that in probably January or February of 2017. But vaccine trials take a long time to prove efficacy or not. So we don't expect to have an answer before the early to mid 2018 at the earliest. So that's more of a long-range solution. The short-range solution is aggressive mosquito control.
Dr. Fauci, thanks for the time.
Good to be with you.